my name is Savannah Brown, and I'm going to inform you of how to perform CPR on an adult today. CPR is one way to save a life. According to Mayo Clinic's article, CPR First Aid, CPR stands for Cardiopulmonary Resuscitation. People can use this method even if they are not a trained medical professional. The American Heart Association's article, CPR and First Aid, says that CPR dates back to the 1700s, but of course has been much revised since then. CPR and First Aid also states that in 1903, Dr. George Child reported the first successful chest compression. CPR is constantly changing its methods, but today I'm going to inform you of how to perform it in the most recent way published. CPR can help save lives if it is done correctly and on a timely basis. Mayo Clinic's article states that CPR is used in an emergency when people are having heart attacks or cardiac arrest. These complications usually can cause the person's heartbeat and breathing to come to a stop. This is when it is most essential to begin performing the steps of CPR. There are some things you need to quickly check before you begin performing CPR. First, you need to check if the person is conscious or unconscious. To do this, you must loudly say, "Are you okay?" and tap or shake their shoulder. If a person does not respond, your next step is to call 911. If you have someone else there with you, send them to call. If you do not have someone else there, call 911 yourself before beginning CPR. If there is an AED available, obtain it quickly and begin using it. According to National Heart, Lung, and Blood Institute's article, What is an Automated External Defibrillator? An AED is a portable device that checks the heart rhythm and can send electric shock to the heart to try and restore a normal rhythm. It is automated, therefore it will give you the instructions on how and what to do when. The American Heart Association has made an acronym to make it easier for people to remember the steps to do in what order during CPR. The acronym is CAB. The C stands for compressions, the A stands for airways, and last but not least, B stands for breathing. Compressions are performed first. They are known to be one of the most important steps because the body still has oxygenated blood in it. The oxygenated blood will be pushed through the veins and vessels with compressions. To perform compressions, one must place the unconscious person flat on their back. Next, one must get on their knees facing the unconscious person's chest. Place your hands on top of each other and interlock your fingers. Place your hand in the middle of their chest, right between the nipples. Once your hands are placed correctly, be sure to keep your elbows locked and use your upper body weight to push straight down on their chest. Push your hands about 2 inches into the chest each time. Repeat the step for 100 compressions per minute. After compressions comes airways. This step should be performed if you are comfortable with CPR and have been trained. If this criteria is met, one can then gently tilt the head back with their palm on the unconscious person's forehead and lift the chin forward to look for any visible obstructions in the airways. If something is visible and one is able to pull it out, then do so. After the airways are cleared, check for normal breathing by looking for the chest movement or putting your cheek close to their mouth. Next in the CPR procedure is breathing. This part can be done by mouth to mouth or mouth to nose. First, open the airway by using the head tilt chin lift method. Make a seal over their airway by pinching nostrils and then give 2 rescue breaths. Give the first one and look for signs of the chest moving. If no movement, try the head tilt chin lift method again and give the second rescue breath. Follow this with 30 compressions. Continue to repeat 2 rescue breaths after every 30 compressions. Continue CPR until the person shows signs of movement or medical professionals have taken over. CPR has to be performed differently for children and infants. They do not require as much pressure than adults do. This is why it is good to become certified. American Heart Association's article, CPR Facts and Stats, states that 70% of people feel too helpless to perform CPR. CPR Facts and Stats also says that the life you can save with CPR is most likely going to be someone you love. I have now explained to you how to perform CPR on an adult, and I hope you can use this to your greatest benefit.
Hands.
Let me get this back.